All right, so I'll get like there we go. You'll get a notification about recording. Okay, so hello and welcome everyone. My name is Mary Marshall and I'm part of the California Council on Geriatrics and Gerontology, long name, CCGG. We're very excited to have you all here today to learn more about some I'm really excited about all these topics because they're a little different than what we've had in the past. So I'm really excited for us all to learn from everyone. I'm going to actually pass it over to Maria, who is our Dr. Maria Karpiak, who is our president of CCGG, to kind of give us a little reminder of what CCG is and welcome to anyone new to kind of learn what we're all about.
Thank you so much, Dr. Marshall. We're an informal group. I'll use first names. We really are excited that you're here this morning. And like Mary said, I'm serving as the president. Mary is our incoming president when my term is up. And just as a little bit of context about who we are, our vision is to cultivate a state that celebrates the value of every older Californian. And our mission statement, I'll put in the chat box just because I'm a visual person, so it's a lot of words, but we really, we aim to promote the quality of life of our very diverse population in the state of California. And we do that through three main arms, basically, of our organization: education, networking, and advocacy. And these research roundtables really serve both as the educational piece as well as the networking piece. So we really encourage you to be very active during today's presentations. We will have Q&A times. I know that Mary will kind of give us the lay of the land, but please use the chat box. We want to get to know you, get to know each other. This is a really good forum for some brainstorming and some unique learning. So again, I'd like to thank all of the board members. If all of the board members who are in the room could kind of just like wave, do a dance. There we go. Alex is doing some of this. We are always welcoming of anyone who might be interested in getting some leadership experience. Our board is very exciting and we have a lot of fun. So we always welcome you to join us. With that being said, I'm going to pass it back over to Mary, and I'm really looking forward to today.
Thank you. So I think our presenters are all organized by Donna. Thank you so much, Donna. And so I think everyone in the that's presenting today knows how they're sharing their screen. And we have kind of our order. And I will introduce each presentation. You'll kind of share your screen, go through your presentation, and then we'll do a Q&A after each presenter. And then at the end, if we have more time, we can do more kind of group Q&A discussion. Donna, is there anything to add to that?
No, just have some fun.
Great. All right. So
I lied. I'm sorry. If you could put where you're from in the chat box, that'll just be nice to kind of create community and some recognition. So back to you, Mary.
Yes. On that note, if you have a question and you're too shy to say it where everyone's talking, you can just pop your question in the chat. I will check that as well when I'm kind of moderating the Q&A. So throw your questions in there. Even in the middle of the presentation, you could throw something in and I'll be watching for it. Or we can talk at the end of each presentation. All right. So we're going to start with Elizabeth. She's going to be telling us about evaluating a friendly collar program in a post-COVID world. And so Elizabeth, when you start, can you just give us a little introduction to who you are, where you're from, all that good stuff?
Yes. All right, so good morning, everyone. I'm really happy to be here. Thank you to CCG and allowing me for this wonderful opportunity. I am Elizabeth Arciniega, and like Mary said, I will be presenting on evaluating a friendly collar program in a post-COVID world. A little nervous. So I just wanted to thank my thesis for Dr. Maria Karpiak, Alexandra Wilkinson, and Nicole Smith. They were my rock during this process, and I gained so much valuable information, and I just wanted to thank them. And so I'm just going to kind of go straight into because it is kind of a long presentation. So if that's okay, I'm just going to go straight into it. So I just, before I get started, I want to define, excuse me just one moment, let me fix this. Okay, so I just wanted to define loneliness and social isolation. So loneliness is the feeling of being alone even when you are surrounded by others. Loneliness can arise from not having the desired meaningful connections, whereas social isolation is the objective lack of relationships and social interactions with others. So during my presentation, I will be using Friendly Caller Program, or sometimes FCP for short. Okay, so the purpose of my study was to evaluate the impact of an intergenerational telephone support program on loneliness and social isolation for older adults. I had three main questions. The first one was what effect has the Friendly Caller program had on older adults, loneliness, and social isolation? What aspects of receiving a telephone call from the student was most felt helpful, and how has the Friendly Caller program enhanced the life of the older adults? So what do we know about loneliness and social isolation? As of 2019, 54.1 million US adults were 65 years or older, and representing 16% of the population, or more than 1 in every 7 Americans. By now, these numbers have already grown. Older Americans have more risk factors for health conditions, chronic diseases, loneliness, and social isolation. So about approximately 1/4 of community dwelling Americans aged 65 or older are socially isolated, and a significant proportion of adults in the United States report feeling lonely. Loneliness is also more dangerous than obesity. It has the same impact on mortality than smoking 15 cigarettes a day. So the research have aimed to address social isolations and loneliness by studying how the community, family support, and support programs impact the lives of older adults. The community in which older adults is associated can have positive influence in participation of social activities, connection with others, and making new friendships and sharing similar interests. Some interventions to address loneliness may include creating green spaces, animal contact, peer support groups. And another intervention that has been really important is transportation. Past research has shown that a free bus pass travel is associated with reduction in depressive symptoms and feeling of loneliness among older adults. So those are just a few examples of the interventions to address loneliness and social isolation. So the background of the problem, social isolation and loneliness affect older adults' mental, physical, and social health. Social isolation and loneliness can negatively impact an older adult, both psychologically and behaviorally. Older adults who do not have that social relationships tend to have negative health behaviors and higher stress levels, and those can impact them negatively. In addition, health issues such as poor physical health and mental health can negatively have consequences, again, to loneliness and bring social isolation among the older adults. And lastly, there are both internal and external variables that can have an impact on those three negative, and they'll have those three, the biological, physiological, and psychological social health, as well as the negative repercussions. Sorry, I got it. So which I'll kind of go into those a little bit later. So for my literature review, there are 3 effects of loneliness and social isolation. Again, mental, physical, and social health. With the mental health, it's all very inclusive to our emotional state, and the social well-being can affect our how we feel, how we act, and how we think. When loneliness and social isolation aren't addressed, that can also lead to mental illness, such as depression and anxiety. And also, so say about age 65, our functional limitations They become more common, and so about 50% of the adults age 65 or older are reporting to have mild or severe functional limitations. So without being able to move or get around as easily, that too can again bring those isolation and loneliness into your ability of not being able to be social. And then lastly, as one gets older, the number of relationships diminish and social networks begin to decrease, resulting in a higher possibility of having less social contacts and becoming again socially isolated. So as for the internal factors, past research has found that the sensory impairments have is a big factor. There's hearing, vision, and mobility. Those who have a dual sensory impairment, specifically both vision and hearing loss, are more likely to experience cognitive impairment, which can cause, again, the loneliness and isolation. So the feelings of loneliness and isolation can lead to depression, which is associated with cognitive decline. And the overlap is what becomes affects your mental well-being. So most specifically, it'll cause depression and then social anxiety. And then that'll lead to social loneliness and social isolation. So it's kind of like a rolling effect, like the domino effect. And then lastly, the external factors. There's the economic status, technology, and living alone. And again, like I mentioned, transportation also. So let me see. Literature review. So how are we addressing loneliness and social isolation? Currently, some of the solutions that are out there, we support our community. Family support is important, and then the intergenerational programs, which is a fast trend that we are currently using to reduce the loneliness and combat against social isolation. Research has shown positive findings to characterize the potential psychological benefits on how the older adults and the younger participants interact with each other. Telephone support programs, there have been many studies done now on how telephone programs, especially after the COVID-19 shutdown, and how those have helped decrease social isolation. So there have been shown to increase the connectedness of the older adults participating in those telephone support programs. So lastly, the Friendly Caller program at CSULB, which is the one that I was doing my research on specifically. And at this time, if I'd like to pass it over to Alexandra, so give us a little bit of a background on the FCP program and CSULB and how it's connected.
Hello, everyone. Thank you so much, Elizabeth, for partnering with me to evaluate this program. My name is Alexandra Wilkinson, and I have been kind of taking over this program since summer 2021. And it's a small program, but yet we still have a good number of participants still enrolled. And one of the greatest parts about this program is it's not just how do we help older adults, but we also connect them with our students through Cal State Long Beach, and they get to grow their own communication skills and be ready for the world as a gerontologist. So a little bit about, do you want to go to the next slide? Oh, there we go. Okay. So a little bit about the methods that Elizabeth used. It was a qualitative method study that was used to gather data through the exploratory questions that you saw in the beginning. Older adults and the callers were both open to receive surveys. So we evaluated both the perspectives from the older adults and the perspectives from the students that were making the calls. The facility is a low-income independent housing unit in Long Beach. And basically, they usually receive between one call per week or more if the student and the older adult are welcome to it. It's really up to them to determine what is the number of calls that seems to fit for both of them. The purpose of the study was to evaluate current program participants and past program participants. And the participants ranged from age 60 to 90 for the callies, and I don't believe we have an age range for the callers. But those were pretty much all university students or university students at one time. And they span a great diverse discipline span from speech language pathology to psychology to human development and some Masters of Science students in gerontology. So it's really fun to see the different disciplines really get immersed in this field of gerontology. After Elizabeth received IRB approval, a flyer was sent to all participants, and after some gentle reminders and encouragements, we got at least 5 participants to submit the form, and I believe 5 volunteers. So she got some great data, and I am very thankful for the data analysis that you're going to see shortly.
Thank you. Yes. So for the due to the time constraints, I really didn't have any and the small sample, I just kind of am going to focus more on the valuable quotes received, both from the receivers and the callers. But from the receiver side, I think the three main themes that we found was involvement, connections, and relevance. So I think, so say for example, one of the questions that was asked directly to the receivers, which are the older adults receiving the calls, was why did you decide to participate in the program? So one of them said, COVID was happening and I wanted more interaction while being stuck in my room on lockdown. Another person said, I did not want to disappear. When asked about how has the FCP helped you stay connected in a post-COVID world, one answer really stuck out. She said, I live in a building with 100 people, but sometimes we do not talk to each other. So having a caller call me is nice. So the consensus was that they all were enjoying receiving these calls. And one of them actually said, getting a call or two is helpful and makes me feel like I matter. So there's that relevant being part of a community and not being forgotten. As for the callers responded similarly to the receivers, where the effect of the FCP has had on loneliness and social isolation. That connection was one of the main theme on their answers. According to one of the callers, they said that they think the program has positively impacted their feelings of loneliness, and having someone to talk to, even if it's just on the phone, can make a big difference in connecting with people. One person has interned in the FCP program for 3 years now, and they are still friends. So they're still connecting, which I think that's so wonderful. And then another caller reported that it has helped older adults feel accepted and not forgotten. So after analyzing all the surveys, the studies have shown that the participants are more understanding, and also the callers have empathized with older adults. So lastly, one of my other questions to the FCP was asked about the FCP program in a post-COVID world. Some of the callers said that it was still relevant in the receptors' lives and that it plays a huge role in providing them with those connections and those relationships with others that the people need and deserve. So although the restrictions of isolation on keeping 6-foot distances has dissipated, the research has shown that the FCP program in a post-COVID world still has that positive impact on older adults. Okay, so the conclusions and limitations. It's important to note that when the survey went out, a lot of the receivers they did not actually wrote down that they were lonely or socially isolated. However, with the data, it was inferred by the answers that they did have some sort of feeling of like missing that connectedness. So we gathered the information to conclude that the data collected reinforces the importance of the FCP effects, and that it does address social isolation and loneliness. The results also receive that the receivers enjoy receiving the calls and that they actually look forward to connecting with the callers. And the similarities between the responses of the receivers and the callers coincide with the affirmation that the receivers do like to receive the calls. So the results of the study were similar to other research where students' perceptions has had beneficial effect with other respects to older adults. As for the limitations, we did have a very small sample size. As Alexandra had mentioned, that from all the surveys that we received, some of them were not completed, or one of them still was not actually active in the program. So there was a very small sample size. Another limitation of the study was that it was a survey online. So some of the answers were extremely short. So this is an opportunity for us to actually review that, and maybe in a second study of the program, rather than doing an online survey, maybe doing an in-person interview, or more of a focus group would be a recommendation. And for the future recommendations, in the future, FCP could prove a wider range of services, such as a greet and meet. Also include Zoom and FaceTime to give those options, especially for the callers who have to either go to work or school. And then another recommendation to expand the FCP program is possibly working with ombudsman, different organizations, and government entities such as senior centers. Some of them may have volunteers that can make those calls so that they can be social and yet reach out to those older adults. So in conclusion, the results of my study suggest that one such intergenerational telephone support program has been effective, reducing social isolation and loneliness. And so at this time, this concludes my presentation. Thank you.
Thank you to both of you. That was wonderful. I really enjoyed learning about that. And so I will first say, because I put it in the chat, but I wanted to make sure both Elizabeth and Alex hear this as running the program. I noted that since those quotes were so powerful, you should definitely use those when you're training volunteers, like new people, and be like, this is the impact it has. Because I think that I would feel like so much more motivated hearing that. So I hope that you can continue to share those quotes because they were really, really, really powerful. So thank you so much. I'm going to open it up and see if anyone else has questions.
I have a question.
Yeah.
Yes.
Did you ask the callers to give quotes on their experience, and did you have any impactful quotes from them?
Yes, some of them were shared. It was, I think one of them was where I think that they themselves think that it has impacted the lives of those others in loneliness, and having someone to talk to over the phone, they've seen a change. They hear them over the phone, and it's kind of one of those inferred things because, like I mentioned during the presentation, that there was one particular caller that has been in contact with this person for 3 years. So I think that was part of the limitation, where because it was on a survey, online survey, maybe when they received the survey, they didn't exactly have the time to complete it, or maybe they rushed it. So I really try to pull from them. Again, the sample was kind of small, so I try to pull those. So I'm kind of limited, but from what I understood is that they did really enjoy hearing from making those calls and that they saw the benefits of those calls.
I would think it'd be impactful for them to share how it affected their own personal life and their views.
I will
on-
add that a lot of past and current volunteers are doing graduate work right now. I have one student who is at USC. I have a student getting their master's in SLP. So with the very, very limited time they have, I'm very thankful that they filled out the survey.
Looks like Chris has a question.
Yes, I was just thinking, you know, to follow on, this would be a great qualitative study to just, you know, record some interviews and make it into a bigger study.
Yes, I agree. I think doing a personal or a one-on-one interview, because then you can do those follow-up questions. And I think those would be very necessary to pull more information from them. I thought it was restricted to do it online. And then we also don't know how tech savvy they are. You know, and so I think there's a lot of variables that could have positively been different if it was a personal interview.
Those are time consuming though, so
They are.
you're limited when you're in your program. I understand that.
Yes.
There was a lot of chit chat in the chat box about how having telephone conversations, it seems like I feel like at almost age 50, I'm kind of on the border of that age group that, you know, I have some friends that really like chatting on the phone, but I'm kind of like, just send me a text or an email or so I'm sure for some of the younger callers, just as honing those communication skills of having a phone conversation is a really big lesson for them, because still a lot of the work they might be doing with older adults in their jobs and things might be telephonic. So I think that's just another fantastic lesson. Yeah, Veronica likes to chat on the phone. I'm like, Veronica, just text me. I'd rather go on a hike and chat in person.
Yeah, so you know, on that note, Maria, I think it's awesome that it's kind of building that skill intergenerationally with, you know, everybody benefits. So I see Erica.
Hi, quick question. Did any of the participants, whether it was the older adult or the friendly caller person, talk about any of the challenges with building rapport? Initially, calling someone that you don't know can be quite challenging. Curious to see if there was any feedback around that.
Not on my end, not on the questions that I asked. I didn't specifically ask. I'm trying to recall if I did ask if there were any issues. It was more about what would you change. Some of them were a little bit more in tune to possibly FaceTime rather than Zoom, which is kind of interesting because they didn't want to do Zoom, but they wanted to do FaceTime. One of them did say that when the caller would call, it was the wrong time. So I think they kind of missed each other during those times. But not necessarily a major challenge. Yeah.
Thank you.
Question, though. Thank you.
That's a great thing to explore in another study, right? Because so many students are like, what do you mean? You want me to call somebody? How?
All right. Well, in the interest of time, I want to, Christopher,
Yeah, I
quick
just have
question.
great study. I have one quick question. If you look at a pool of people who might benefit from the calls, I would think it would be pretty broad. But then for part of the group, part of their personality might be, yes, I'm isolated, but why would I want to talk to somebody? I don't want people embarging on my life. There's another group who say, yeah, let me talk to somebody. And they might already be kind of out there in the world circulating a little bit. And then you have this group in the middle who could go either way. And I was just wondering, granted, it's only 5 people, but were you pulling from the group who's kind of outgoing anyway? Did you get some people in the middle? And as you think about expanding the program, how might that sort of segmentation fit in?
Yeah, so these individuals were inherited to me. So as far as how they were recruited, I wasn't really a part of that. These individuals started receiving calls during COVID, so I think it was just a very different time where it was kind of like you talked on the phone or you didn't talk, right? But we are looking to expand, and we would love to reach more individuals that maybe are a little bit more like, why do I want to talk to somebody, right? But then once they get involved, they can see the benefit, because those are the individuals that we really want to capture, right?
Right.
Because they might benefit the most from it. So thanks for sharing that. We will definitely work on figuring out how to make it more open and get individuals that are would benefit most.
Yeah, great. Thank you.
Yeah, and I'm going to add to that, Alexandra, because I received, I don't know how my flyer got out there for the study, but I got a call from someone, I want to say City of Cypress, where saw my flyer, and she's asking about the program and wanted to learn more about it. So I was like, okay, they are interested in this program, even though it was a study. But so I reached out to them, and I'm hoping I could get a hold of them and see what their thoughts are and maybe how we can start a program. And I think that's one of the reasons I added senior services, because they might have a need for those individuals that would benefit from telephone calls.
Great.
Thank you. Chiquita, just 1 minute real quick, and then we'll move on to our next one.
Okay.
You can say what you need to say for a minute is what I'm saying.
Oh,
You can ask a quick question.
Yeah, I just had a quick question. Because you said this was during the pandemic, I'm wondering how many of the older adults were interested in receiving calls for safety issues. Just example, I had one of my neighbors walk down the street. She lives alone, and she asked me, can you please call me someone just to check on me, make sure I'm still alive? So that was my question. Just wondering how many were just interested in having somebody check on them.
I don't know. I'm sure originally that was definitely one of the things that drew people there. The participants do live in a building that does have like a coordinator and that stuff as well. So there is somebody already checking on them. But I could imagine that was one of the appeals to joining the program.
That's a really good point. Thank you. Thank you for bringing that up.
Yeah.
Well, great presentation. We're going to move on to our next one just to make sure we get through everybody today. So next up, we have utilization of student health services by older learners from Chris Campbell and colleagues. So please do introduce yourself and others when you start your presentation.
Okay, I will share our screen real quick. Hold on. Can you all see it?
We're seeing a screen about your Zoom meeting starting.
You don't want to see that. Oh, no. How about that?
There you
Yeah.
go.
Okay. Okay. All right. Do we want to? Well, I'm Christina Campbell. I am from Cal State Long Beach. I am a professor in the School of Nursing. I teach mainly in the nurse practitioner program, which just got, it was a master's level program, and we just transitioned to a doctoral program, which has been really interesting. And I also work 1 day a week in a student health center at a community college. And I'll let my other colleagues introduce themselves.
Chris, real quick, could you do full screen on your presentation? Might make it great. Okay.
Jill, go ahead and introduce yourself since I'm presenting the first set of slides.
Okay, well, I'm Jill Cardusely, and I also teach in the School of Nursing at Long Beach, and I also teach in both the FNP program and in the undergraduate program. And I also work at a student health center and have worked at college student health centers for about 15 years and love that population.
And I am Maria Karpiak. I am a professor in the gerontology program at Cal State Long Beach. And I don't work in a student health center, but I do want to recognize our fourth partner, Laura Conahan, who also is in the nursing program. And I think she's in clinic today, so couldn't join us. You know, one of the things I love about being a gerontologist is the interdisciplinary nature of our work. And so, you know, I'm trained as a social worker, and to partner up with my nursing colleagues has been such a joy. Sometimes they talk about gross stuff, but I also learn a lot of things. So I'm really excited to be partnering with colleagues from another part of campus. So we're going to present a little bit about a study that we just completed about how older learners use our student health services. And we'll talk a little bit more at the end about how we're carrying this forward. Next slide, please.
It's not
You
moving.
got it, Chris. There you go. So just to give you a little bit of context about why we're interested in this particular topic, as you may or may not know, a few years ago, a network, an international network, was established called Age Friendly University. This kind of sprang out of the age friendly community movement. And basically what we're trying to do by distinguishing ourselves as an age friendly university, which we did a few years ago, we're not saying that we're a perfect university in terms of all things aging friendly, but what we did is made a commitment, and this came from the higher up administration at Cal State Long Beach, that we would make a commitment to taking a look at the way in which we operate, how we offer services, to make it age friendly. The bottom line is that if our university is age friendly, it's not just friendly to older learners, it's friendly to learners of all ages and of all abilities, all needs. So currently there are 90 and growing universities in this international network. And so we decided to focus on one particular principle of the age-friendly network. And so in the next slide, I'll show you what those principles are and which one we really focused in on. But for this study, we wanted to look at what's going on with how we're offering health services for students of all ages. And there is very little to no research out there about this, which again, in this field of gerontology is always kind of exciting. I know it can freak students out when they start looking at, you know, a very cutting edge topic and there's no literature out there. But for those of us that do this research, we're excited when there's no literature because we have the opportunity to really contribute something. Next slide. So here are the age-friendly principles. There are 10. So things like making sure that older adults are considered in all activities of the university, that they have the opportunity to come back to school to pursue second careers or just pursue education for the love of it, to look at the way in which we offer education and that it meets the needs of folks that have all sorts of abilities, experiences. We look at intergenerational learning. So we just saw an example of a presentation of where it was an intergenerational exchange. So we want to make sure we maximize that, that we help older learners come back and feel comfortable learning with all of the technologies and the online offerings that we have. Next slide. To make sure that our research keeps in mind the needs of older adults in the community, to make sure that our students, all students, not just the ones going into this field, but that they understand how important it is to understand the needs of older adults and the fact that we're in general living longer and that the proportion of older adults is growing around the world. And then the one in blue, the one we really focused on, to enhance access for older adults to the university's range of health and wellness programs, as well as arts and cultural activities. And then also to reach out to maybe faculty that have retired and regular dialogue. But again, going back to number 8, that's really the one that we're focusing on for this study. Next slide.
Okay. Why do you not want to advance? Okay.
You got this.
There we go.
Cool. So one of the things that's just becoming more and more loud and clear is that, yes, older learners, and by the way, I should do some defining of what this means. So traditional students are those that are 18 to about 22. 22? Yes. 23 to 49, we kind of call non-traditional students. And then 50 and above, we call older learners. That's kind of where the literature is going in terms of kind of categorizing learners. Some universities just use non-traditional for anybody over again, I think it's 22. But what's happening is, any of you that are in education might have noticed that there's been some interesting things going on in terms of enrollments in universities since COVID. We're seeing a lot more non-traditional students coming back to school, either because they want to, again, prepare for a second career. Maybe they just want to go back and learn about experiences they've already had in their lives. So we're seeing more and more older non-traditional students coming back to school for a degree. So that's even aside from programs like OLLI or senior universities. Yes, so college enrollments are still predominantly that traditional age, but if we want to look into the future and look at the future health of universities, we need to be paying attention to this growing proportion of older learners. And so that's why it's very important. And the health and wellness of our students is becoming even more and more front and center since COVID, especially mental health needs. So next slide. So again, we really wanted to focus on, is our student health center doing a good job of reaching and outreaching to this group of students? So our goal was this first phase. So this is really the first phase of a multi-phase examination, is to see if our student health services are adequately meeting the health needs of older learners. So the first step is just to take a look at how are older learners using student health services, and then how are they? For what needs are they going to student health? And hopefully we can use these results, we kind of already are, using these results to better inform student health services and other services on campus of how they could maybe better reach this population. Next. So what we've done is oh my goodness. First of all, getting data from student health services was definitely a challenge. Not that we were even getting sensitive information, but we'll talk about this in the limitations. But we did get retrospective data, and we chose to use 2014 to 2019. We chose purposely not to use the COVID years because, everything was wacky at that point. We weren't on campus, so we got 5 years worth of data. We actually were focusing on our older learners for this presentation, but we actually have analyzed data from all students that use student health services, age 17, 18, all the way up. But like I said, we'll focus on older learners. We painstakingly, but enthusiastically, coded all of those visit types. And then we did independent coding, and then we paired up and we double checked each other's coding to increase our validity. We finalized a code list. We had discussions if there were any disagreements or any confusion about the code list. And then we analyzed all of the data so that we could accurately describe the sample and the reasons they were coming. And again, the bigger study is that we made comparisons amongst those three groups. So traditional, non-traditional, older learners, to see why are they going to student health services. And now I will pass the microphone on to the next person who will talk about our results.
Okay, next slide, Chris. Thanks. So just to reiterate, the older student that we looked at was aged 50 to 69, and we stopped at 69 just because there was nobody that utilized the Student Health Center that was over the age of 69. So we focused mainly on the age 50 to 69. If you go to the next slide, a breakdown of the ages in that bracket, 59% of them were between the ages of 50 and 54, 24% 55 to 59, and it just kind of lessened from there. Unsure exactly why it's that way. Perhaps at 65 you have Medicare, and maybe that helps a little bit. Not sure why. Or perhaps when you're older, you're not in the programs maybe that require you to have physicals or labs done in order to go to clinicals. Next slide. So we had a total of only 181 students that came and utilized the Student Health Center, and the vast majority of those were female at 67%, 31% were male, and only 2% didn't specify gender, which is not surprising in that age group. There's a little more of those in the younger age group, but the average age was 55 years. Next slide. Breaking down into the ethnicities, the vast majority of the older students were white. However, the vast majority of students attending Cal State Long Beach are Hispanic. So it's interesting that that was such a lower percentage that utilized the Student Health Center within this age bracket. And I was very surprised that 29% or 52 students did not specify what their ethnic background was, because usually those in my generation were very, rule followers. And yes, I'm going to answer every question that's asked of me. And so I was kind of surprised at that. Next slide. So if you looked at a breakdown of the percentages by year of the older students that utilize the Student Health Center, 15% of them utilized it in 2015, 12 and 2016. And then for some reason, there was a drop 2017 through 2019 to 7 and 8%. No idea why. I know that in years past, in the Student Health Centers where I've worked, like in 2009, 2010 through 2012, we had a lot of students that were older that would come in because they utilized us as their form of insurance because they didn't have insurance. But with the Affordable Care Act, there was more opening to that. And I don't know if it just took a few years for people to utilize that and get more insurance. Now, this is pure speculation. We did not investigate that, but unsure why that there was a drop in the utilization of the Student Health Center. Next slide. So we wanted to figure out why the students used the Student Health Center, why the older students used the Student Health Center in order to help the Student Health Center make sure that they had the appropriate options for older students. And we broke them down into 3 main categories. And those were health promotion and maintenance or preventative care, episodic or sick visits, and then mandatory requirements. And those were for programs that had like a clinical component where they had to have maybe a TB test done. We did not focus on long-term care or long-term diseases, chronic diseases, because the Student Health Center is not a place for primary care. It's a place just to kind of help out the students where they are. And while we can help patients that have chronic conditions, that was not the focus, because that's not the role of the Student Health Center, because we don't have providers that are on call 24/7. We're closed over break time. And it's important if you're treating chronic behaviors to have, or chronic diseases, to have those, that availability. So next slide. Just to let you have a breakdown of what we looked at health promotion and maintenance were things like meeting with a dietitian. And it's fabulous, I think, that we have a dietitian, because there's so much misinformation out there about diet. And sadly, so often we equate, oh, you're skinny, you're healthy. Oh, you're larger, you're not healthy, without thinking that, no, you still need to focus on these things for both sets of people. And quite often, you've got a thin person who maybe doesn't follow the proper diet. And as we get older, our diet changes. So it's great for that, for the older learner. Things on health education, stopping smoking. Acupuncture was a big one. We did find in our study that like one student utilized that a lot. And so it kind of skewed that result a little bit. But case management, just following up on things, making sure things were going okay with them, maybe follow-up visits, physicals, and lab tests. Next slide. So the episodic or sick visits broke down to things like allergies or insect bites, upper respiratory infections, things with the skin, GI, GU, a lot of mental health issues. Orthopedics, surprisingly enough, the older population with all of our brittle bones didn't use it very often for that visit, but the youngers did. And then radiology and just some miscellaneous visits. And the last one that we broke it down to was the mandatory requirements, which pretty much was just TB testing, and that was for going to clinical sites. And so that was kind of just the focus of that one. And I'm going to pass this along now to Chris.
So just to sum up our study, we were really the only study that has ever really looked at older adults and student health services at all. I searched for every combination of terms when I was doing my literature search, and there was just nothing out there. We found one study, and I think they stopped at the age of 49. So this is kind of unique. So what we did find out is with our limited sample size that the people that were over age 50 that do utilize student health services more were female, aged 50 to 54, and white. And to be honest, that's not unlike the general population, at least when I was working in primary care. Women tend to go to the doctor more, or to their provider more. And a lot of times our Caucasian patients tend to see their providers more. So that's an issue. We need to figure out why that is and figure out how we can increase utilization in our older male and non-white student population. So what's keeping those other populations from coming in? And also we need to know what are the health needs of patients over 50 and what might be keeping them from coming in. So we did find a couple articles that talked about not necessarily patients over 50 or students over 50, but non-traditional students. And maybe some of the issues are that they have different health needs, and access to care was a huge one, is that a lot of times our non-traditional students have families, they're working more compared to a traditional 18 to 22-year-old. And that, you know, if student health closes at 5 o'clock and they have to run and get their child from daycare, they're not going to have access to coming into the clinic. So maybe having extended hours at student health where they can be seen, or even weekend hours, might benefit them. Also, efforts that target non-traditional students might help health disparities. So, and also, you know, at some point we really do need to look at, and I know there's a lot of studies that are looking at, you know, how has COVID affected students. There are a lot of studies, especially about the mental health effects of COVID, increasing anxiety, sleep issues, depression. So definitely, I think there have been increases in mental health needs, with many student health services having to increase their number of psychologists and counselors to increase their ability to provide for those issues. So in conclusion, we really do want to be that age-friendly university and make sure we're providing the services that are needed. We want to continue our research, and we are doing that. We just, in the last semester, put out a survey to all of students age 50 and above, asking about how they felt about student health services. Have they gone and since they've been a student, have they accessed student health services? Do they even know where it's located on campus? If they have, what were the reasons they went? So a whole total survey, and we're going to write that up. And then the next step is we're going to survey all of the Cal States in California to get more information on that. And then taking all that data, we're going to take it to the student health services and say, okay, this is what student older students need and how can we better offer that to them. From our survey, some of the preliminary findings we found is that what they older students really need is they need help with their preventative testing. So, you know, as you get older, you need your screenings for cancer. A lot of the individuals that took our survey were behind in their colonoscopies, in their pap smears, and their mammograms. So even though Student Health Services might not be set up to provide those services, they could have the older student come in, sit down with them, and help them be able to make a list of the testing they need and refer them to places where they could get those services done. So that is where we are in our study and our future studies. So
Thank you. Thank you so much. This sounds like a really good, I love a study that has a good future plan. So that's
Absolutely.
wonderful that you guys have a good trajectory moving forward. We only have time for one quick question or comment. And I will direct if anyone else has questions or comments for this group to put them in the chat. I know Maria will be in there typing away answering, but we can do one quick question or comment.
And I'll say if anybody from any of the CSUs in the call here has a connection with their student health services, please send me the contact info because I'll be embarking on that project in the fall. Emiko.
Emiko?
Hi, just wanted to share my conversation with one of my older students in our gerontology program, and she actually visited the Student Health Center on our campus. And her experience was that a subtle ageism at the front desk. So it was just a mandatory visit, but she just didn't feel like she belonged there because there were lots of younger students there, and her health concern wasn't something that they were familiar with. So there might be some subtle ageism issue that you might want to explore.
Yeah, even in terms of like posters on the wall or, you know, something to clue them in that you're welcome to. Thank you for sharing that, Emiko.
That's a really good point. Very good point. All right, thank you. So yeah, please do comment in the chat box if you have more questions. Right now we're going to move on to our next presentation. And this one is Poetry is Power, Empowering Nursing Home Residents Through Found Poetry with Sarah English. Are we? Oh, there we are. Okay, good. And we don't hear you. If you're talking, I don't hear you.
That's because I couldn't find the button.
Wonderful.
Okay, so let me just start here. Okay, so hello everybody. My name is Sarah English, and I am from South Carolina. I'm in South Carolina as well, and I'm so happy to be with you all today in this virtual space, especially presenting this research because April is National Poetry Month. So today, I want to share the idea of poetry as a tool of empowerment, specifically for older people, and even more specifically, for people that live in narrow spaces. Nursing homes and other places of congregate care fall under the definition of a total institution, as described by Irving Goffman so many years ago. And I started a study several years ago exploring younger people who live in nursing home care. That would be people that are under the age of 65, who live in nursing home care, and what their experiences are like growing older in a place where the policies and procedures are usually geared towards much older persons. So this research that I'll share today began in what I call 1BC, which was 1 year before COVID. And it extended through the time of COVID and into the reopening of nursing homes. So before the lockdowns, I had conducted research with those younger people who live in long-term care, and I wanted to know more about their experiences and their unique needs. So this group primarily were male, primarily white. They often lived without financial, physical, or social supports. Most of these people had frail, fragmented, or fractured relationships with others. And they often end up languishing in care for 20 or 30 or more years. One of the residents that I spoke to had entered the nursing home on his 18th birthday. And 43 years later, he was still living at the nursing home. So during COVID, I was able to visit these younger residents, and afterwards, I wasn't able. And the first place I went after the lockdowns lifted was to the nursing home, where almost all of my participants from my earlier study were still living. But before we start that, I want to share a little bit about poetry. So, poetry is powerful, and poetic inquiry is the process of asking and answering. It creates opportunities for persons to find their voice. And that is an essential aspect of building all poetry. Poetry is, to me, very well suited to provide a way to be heard, to be recognized, and to become empowered. So this study used a participatory methodology of poetry creation to explore the experiences of nursing home residents as they emerge from this fog of COVID. So this slide shows you that poetry makes space for these voices that are often unheard. It's an act of reflection on their own life and lived experiences. It contributes a lot to the gaps of understanding and knowledge. We know that quantitative research is broad and generalizes, but qualitative research is deep. And exploring narrative and poetry allows for this kind of deeper understanding of people. It also gives a space for more diverse voices to be heard. And I think it enhances what we already have. If we're talking about qualitative studies, it can really put a richer color on things. And finally, it empowers the people who are participating, both the researcher and the participants, because it creates something meaningful and something tangible, something that can be held, looked at, referred to. That kind of creation, especially if it's acknowledged by other people, it can really be very powerful. One of the groups that I use this with successfully outside of this study are people that are in the early stages of cognitive loss. Those creations of poems really do add to their world. It gives them something to hold on to, especially when words are failing, when they get this kind of flight of words, flight of ideas. If you can take them and make them into a cogent, poetic statement, that benefits the resident, that benefits the caregivers, that benefits families and loved ones as well. So, poetry has a lot of different forms, right? A poem can be descriptive, as depicted by this poem, The Red Wheelbarrow, right? Which seeks to evoke this emotion and meaning of descriptions of objects. Another form of poetry is this blackout poetry, which asks a poet to take text and literally black out words to distill the text to its essential essence. But poetry can be found in a lot of things. Simple rhymes from our childhood, limericks, romantic odes, very long sagas, even song lyrics, or spitting bars, through rap music too. Poetry is always subjective from the idea of the writer. It also can be what I call found poetry. This is a term that describes poetry that's created from the direct words of persons. Found poetry literally asks people to use their own words to promote their own voice. So one of my favorite ways to use this technique is with people making a transcript from an interview, returning back to them and asking them to pick out words, what sticks out, and then we talk about that. So in the background here, you're going to see a bit of transcript that I used for a poem from the residents that I returned to. So the methods, right? I think of methods as a recipe for a study. So this participatory qualitative study, again, it built on my earlier work, and it had the purpose of exploring experiences of the residents in this liminal space between the shutdowns and the lifting of those shutdowns. So the first thing, of course, was that I applied and received IRB approval. The study was considered exempt because people were voluntarily participating in this and they could give their consent to it. And then I moved through these certain phases. So my population were, again, younger residents in long-term care. Most of them had lived at this nursing home for several years, some decades. And so all of them ended up being over the age of 55 and in the process of aging, except for one who had lived in the nursing home for 42 years, the gentleman I referred to earlier. So it ended up with 6 younger residents of long-term care who participated in that earlier study. I conducted one-on-one interviews after COVID lockdowns lifted, going back and visiting these folks. Each interview lasted about 60 minutes, and they examined their perceptions of what the lockdowns were like and feelings of loss. So these were recorded, and I created transcripts using Timmy.com, which is a transcription service available online. It's also free if any of the students want to avail themselves of that. And it's pretty accurate, actually, for an online transcription service. These transcripts were checked for errors, and those errors were corrected. Then I went back to the nursing homes, and I shared the transcripts with the participants. That's very important. If we're going to help people find their voice, we have to use their voice and seek out their voice actively. So using the transcripts, we asked the residents to identify key parts, key words, key phrases, and the poems were co-created with the researcher. Then we moved to the phase 2, where we received participant approval. Once the poem was completed and printed out, we asked them for any edits, checking against the original transcript for accuracy and authenticity. We also shared the work. We worked with the activity directors, the administrators, the marketing people to promote the resident poetry. We put it in the monthly newsletters. We posted it on social media with permission. We also posted it in the nursing homes, in the spaces where not only could the residents see this, but also the staff. And this was really important because most of these younger residents are seen as being disruptive, being demanding, and sometimes even being dangerous in the nursing home environment. So the idea of sharing their poetry, it sought to humanize them more, to see them as creative, as softer than what they were sometimes being interpreted as being. We also did a follow-up interview after the sharing of the work. And then after everything, we had 2 focus groups. We facilitated a focus group with the participants, asking them all to come together and share their experiences. And we also had a focus group with staff regarding what they thought about the outcomes for the activities. And what we found was staff anecdotally reported that the residents who participated in this poetry building were less anxious, less disruptive, and they had fewer behavioral issues in the nursing home. That was a huge change from where residents were originally perceived. So going on to these findings, we created this poetic narrative, and we believe that that empowered residents to tell their own story at a time when they were emerging from this narrowing of life. And the residents found that the sharing was really meaningful and that it allowed them to tell their story. So among the 6 participants, 100% said that creating the poems helped them feel stronger. 100% reported that they felt more a part of the nursing home environment. 100% said that they enjoyed their time one-on-one with the researcher who helped them build the poetry. And all but 1 said that they would continue this. So this study was used to connect the residents to communities, their own community, and also with the broader world through social media. It also reminded workers and families and residents of the community of care about the people who live with them. It was really, I think, moving towards me and moving for me as a researcher. There are a lot of ways that we as practitioners can use poetry, or as researchers, or just as human beings, especially with older people. We can use them in direct practice. We can use them as a form of life review and memory books. We can help families reminisce through poetry. It creates a legacy. It can be used in group work. You can create poems as a group activity, not just one-on-one. It's a great icebreaker for group work. It also builds communities, and it helps people retain and promote additional communication. And it also helps you advocate for seeing people in a deeper way. So again, poetry as power is an arts-based research methodology which treats poetry as vital for expression and learning. Poetry also empowers the voice of participants through sharing direct words through a process of participatory research and design. Again, here are some of the ways that we can use them. As far as limitations go, this is, of course, a very small study, as is a lot of qualitative research, but it sought to reveal a deeper meaning as opposed to more broad findings that are quantitative. But going forward, I'm going to be expanding this work. And I'm developing a training program for nursing home staff, focusing on activity directors and social workers on how to use narrative and poetic inquiry in these places of congregate care. And I just want to, let me close this a little bit. I wanted to share with you a poem that was created from that earlier transcript, from the earlier slide. This was published recently in a small journal, and it was a combination of my field notes that I made right before I went into the nursing home for the first time, and also immediately after my visit with a resident that I'll call Edgar. Edgar had been in my earlier study, and he was one of my most important critics and advocates, and after this study, my friend. So this poem was created by Edgar and myself together as a collaborative project, and it's called A Little Spice, Reflections on a First Visit After Lockdown. So it is 173 steps to the entrance and uphill. In my left hand, I carry my car keys. In my right, a brown paper gift bag. My cell phone is intertwined within the handles. Been a long time, says the receptionist, who points her laser at my forehead. 98.5. I think you're going to make it. She smiles as she peels the green sticker with the handwritten record of date and time and temperature. Screened, it says. I stick the sticker on my left shoulder and I turn to walk. 412 steps to the room where Edgar lives. Today's a celebration because they've let me walk down the deserted floors. It smells of antiseptic and bleach. Months ago, before lockdown, Edgar would be waiting for me, sitting in the entry hall, his large frame resting on the wheelchair, commenting on people's shoes. You can tell a lot about a person by what they wear on their feet, he would say. I haven't seen Edgar in months. If I were a relative, I would have been relegated to visits through a glass on the front door. But I'm not, so I couldn't. So I didn't. If he was sick, I never knew. If he was well, I didn't know that either. Nobody knew. Because Edgar doesn't have a family, not really. He hasn't seen them for years. And people who haven't seen people for years are kept sealed behind the locked entrances and closed doors. As the virus swept through the floors of the nursing home, leaving a coating of fear that still lingers. I walk along the polished tile, 120 steps straight, turn left, 62 steps, turn left again, 12 steps, I knock and wait. Come on in, girl, he waves at me from the bed. His other hand is on the metal triangle that he uses to pull himself up. Edgar has sock monkey slippers on his feet, which tells you a lot about him. I'm not used to seeing him in his bed, surrounded by alarms and buzzers and bells. He looks smaller and grayer and more frail. Let me see you, he requests as I step back and tell him I'm against the wall. I notices that he notices my shoes, red, leather, gold buckles. And he notices that I notice that he noticed. Edgar smiles behind the blue paper mask as a present that I gift him. It's a little bottle of hot sauce, red, smoky, with a yellow cap. Oh, girl, yes. This food is just so, well, you know. Let me just tuck this away, he says as he shakes his head. Girl, after the year we've had, well, we could all use a little spice. So, as a gerontologist, and as a researcher, and as a social worker, I intentionally seek out opportunities to share these lived experiences with people. This poem, if you want to know, if you're into this sort of thing, it's an adaptation of a Viennaille, which is an 18-line poem that repeats phrases throughout. A Viennaille is a before and after. And that type of poem is perfect for our liminal examination of what was going on. Because even though the words don't repeat here, the emotions do. And this work is an effort to make meaning of that space that we all had. So that's all I have. If you have any questions or queries, I'm open to you.
I don't know if you said and mentioned this. Are you interested in publishing these in a book?
Yes, I've published this poem, the one A Little Spice, that's been published in a journal. Also, I went to not last year because it's every 2 years, but the International Poetic Inquiry Consortium, and we read all 6 of the poems. There's 6 of them. And my hope is that when there's space, I'm going to go back and take photos also. I have photos that accompany the longer presentation about all 6 poems and read them. I think there's really space for this, and I think there's hunger for this. You know, COVID took away a lot. And one of the things it took away was our connection and our humanity one to another. And I think words have power to reconnect people in a very real and meaningful way.
Yeah. Thank you. That was wonderful to hear that. I was so happy there was an example poem because I'm like, I want to hear one. So
Yeah.
thank you. Any
Well, there we
comments or
go.
questions from anyone else?
Okay, Donna.
Wow, Sarah, that was so powerful. I guess my question is more about you. How did you get into this? There was some chatting going on, and we are, and in just looking at the faces of everybody, your work had such an impact on this room, this virtual
Yeah.
room. So I'm
Thank
curious
you.
how you got interested in it, and I just want to compliment you for that creativity piece that we forget so much, and especially during the pandemic, it was just all nuts and bolts care and vitals and keeping you alive, obviously, but
Right.
that creative piece that's essential for all of us. And so a compliment for that. And then just I want to hear your story, and I want to take classes from you, and
Well,
let me know how I could do that.
Well, for me, I guess you could go all the way back, right? All the way back. I love words. I've always loved words. And I was primarily raised by my grandmother and her little coalition of aging and aged people in Northeast Iowa. And so, of course, I would become a gerontologist, right? What else would I do with my life? And, but I went back to school later in life to get my doctorate. And I worked primarily all of my working life in a nursing home. And I had been an activity director, I'd been a marketing director, I had been an administrator and a social worker. And so I love the arts, and I love the opportunities that they offer. And I always thought that nursing homes do a really good job, hospitals do a really good job, we all do a really good job of helping people survive and exist, right? But life is a whole lot more than just existing. People can live a long, long, long time existing, but they don't necessarily live well. And when you do something active with people and ask them to share themselves in a real way, rather than just writing something down on a clipboard, it makes a real connection. And that's what a lot of people are missing. And so I was so hungry to reconnect with these people, and the lockdowns were so strict that I was prevented from doing so. So to me, this was a way to kind of help them express themselves and also help me help them express themselves.
That's wonderful. Wonderful. Thank you.
Thank you.
You're
All right. Well,
welcome.
definitely. Sorry. Another comment? I will ask, where did you get your PowerPoint slides? Because they were beautiful.
I make them.
You made them? Oh my.
Well, this is
You're so
actually
creative.
this is actually a template on Microsoft, but I do all the fancy stuff.
Okay, well, that is a beautiful template, and
Yeah.
then your additional work on it. So good. So beautiful. All right, well, we're gonna move on to our last presentation. Okay, Donna says it's her favorite template. I haven't seen that one, so I'm gonna have to go searching for more templates.
Yeah, it's on the online template.
Yes, I need to
library.
update my rotation, 'cause, they get boring, the same ones. So, all right, we're gonna move into our last presentation, and just we're running a little later on all our presentations because we're having such good conversation. So hopefully you can all stay until 11 a.m. a little bit beyond to get our last little bit here. So we're gonna move on to our last one. It's called The Longevity Diaries About Aging Gracefully with Christopher.
Yes, hi, thank you very much. In fact, I was going to show a couple PowerPoints, but I think I'll just talk through it and we'll get to the film more quickly. I am in my late 60s, so I fall into some of the categories that you guys have been looking at. I'm a business executive turned marketing professor. And so I spent the last 15 years of my career at Cal State Fullerton, and I retired from there about 3 years ago. And one of the things I noticed as I got involved with the activities of some of the retirees is, wow, these folks are doing really well. And my wife and I are very lucky. We're in good health. We have adult children, we have grandchildren, and also we have a 9-year-old who we adopted. So we have a lot of motivation to think about living well and living long. I have a budding interest in filmmaking. And when you put all of that together, I thought I would like to make a film about longevity. So I am very, very appreciative to be here with a group of people who study gerontology, who are gerontologists, and thank you for giving me time to share my film. At the end of the film, if there's time, I can answer a few more questions about the process, so on and so forth. But I think at this point, let's just go ahead and get to the film. And if you have trouble hearing it or seeing it, let me know, but hopefully everything will be working.
My purpose in life is just to get up and have a pulse, That's, you're happy with that. I mean, it's hard for me to think that I'm as old as I am. See, I can't fathom that. So I'm just blessed for each day that I have, and I, plan my day out and I fill it, keep it filled, and keep up with current events and get angry with things. And try to, make the world a better place.
Because every semester I inherit 125 temporary grandkids, right? And so I can spoil them and give them back to their parents. but I really have good rapport with them. I allow them to interview me. They have to interview an older adult, life review of an older adult as their signature assignment in this class. And a few weeks before that, they have to do that. I sit in the middle of the room and they are all free to ask me any questions about aging. And I'm pretty transparent with them. And that seems to strengthen the bond that I have with them and that trust.
I focus on positive things and what I have to do, what I want to do, and let the stress go by somehow. And then but I have a lot of willpower, and I'm very definite about what I want. If I can't get it straight out, I'll work around it, and I'm usually successful and make a friend in the process.
My personal motivation for getting up and starting the day is to fix breakfast for my wife. That's one of my main drivers, which is so highly rewarded through the rest of the day and all the years that I wouldn't give that task up for anything. And no matter what time she wants breakfast on the table, I want to have it there.
I served on 2 boards on campus. I was on the board of the Friends of the Library. I was on the board of what is now OLLI. I served on a board of a charitable organization that I helped start with a friend of mine that was designed to help women gain more financial education in an easy, friendly situation. When my husband died, I was involved with the Villa Park Women's League, and I had gone to a dinner, and a friend of mine came up to me, and she said, "Say yes to everything." And I thought about that, and I thought, you know, she's right.
So my name is Maria Karpiak, and I am a professor of gerontology here at California State University, Long Beach, and I'm also the program director of our gerontology program. We're still retiring, you know, at a certain age historically that we've been, but we're living a lot longer, hopefully in good health. So that's a lot of time to deal with. What would you like to do with it? Aging is about adapting. It's not necessarily about never getting a wrinkle or, you know, not having a sore back when you wake up in the morning, but it's about saying, okay, my body is now doing X, Y, Z. What can I do to adapt?
I mean, stuff happens, right? And I'm aware of that. I've had a lot of things happen over the course of my life, and came down to this idea that there's only really 2 choices in life about everything, and that is whatever's happened, you either get over it or you don't. And what I've seen is people who don't get over things suffer much more than those who say, okay, can't drive anymore, and so we're gonna do Uber, or I'm gonna buy a self-driving car, or whatever it is.
We had to get up and say our name and where we live. And my legs buckled after that. That's how bad I was. But then I had to stand up in front and defend my work. And that's how I started getting over it. I took 2 public speaking classes and flunked both of them. I could not get through them. But little by little, by having to talk about my work, I got over it somehow.
So
So I am Laura Zuttel Watson. I am a professor of psychology at California State University, Fullerton, and I'm also the coordinator of the Aging Studies academic program. One of my favorite findings about aging and coping is a type of coping we call anticipatory coping. And a quick example of that is I'm an individual who will drive until my gas tank, the light comes on, and then I'm like, how many more miles can I squeeze out of that? Hate pumping gas. My mom, on the other hand, will never let hers go below half a tank. In the event of an emergency, she's going to be in better shape than I am.
It's like I say, I think I'm a depression kid, and you always work for something and you don't buy it until you can afford it. You know, credit cards notwithstanding. And my son handles my finances, and he says, "Don't worry, Mom." So I'm not worried in that respect. But I feel so bad for people that do have the worry of situation, and you have to work for things. And I think we're blessed that we live in a country where you can have access and help.
I do think that older adults, through whether it be life experience or enhanced wisdom, over time have gotten better at handling life stress. I think we could all agree that some of the stressors that are faced, like the loss of people close to us, very serious illnesses, could be considered of a higher impact.
You know, there is one problem with associating with old people, and that is sometimes the people you've invested the most personal feelings, the most careful contribution to their patients, their questions, their answers, they die. Of the 75 or so people that started my class in genetic genealogy and with whom I spent the most time because they were outward going, they were open to help, they had interesting stories. 50 of them have died. And that takes a toll after a while, but you overcome it by other people coming along and replacing them and keeping the challenge going.
My name is Blair Barker. I am the Care Services Director here at the Camarillo Healthcare District, and I oversee our Family Caregiver Center, our Senior Nutrition Program, and our Evidence-Based Health Promotion Programming. And I am also a lecturer at California State University, Channel Islands, in the Health Science.
not any particular diet. I watch it, but pretty much scratch make everything. Not too much in the way of processed food. At Fort Benning, I jumped out of perfectly good airplanes. And on one of the jumps, it kind of caused a little minor damage at the time in my right knee. And over time, that was a little chip that's in there. And so I, at some point, had to stop running. And so life is just a continual array of losses, right? And so that was one I lost, so I replaced it with I walk everywhere. And I got one of these devices that tells me how good I'm doing.
I eat right. I don't eat a diet. I eat right. Now, that doesn't mean I don't have a piece of chocolate every day or something like that. But I keep my weight down, and I've done very well on that.
My program, in terms of weight control, diet, and exercise, is largely based on my wife's wisdom and program of hers that says I should have this much, I should be doing these exercises, and she fixes meals that at times are very much Mediterranean style.
I discovered that I was not, my posture had gone to hell in a handbasket, and I decided that I needed to do something about that. My posture and my balance. As you age, you do have to be concerned about balance. And I had fallen a couple of times, and I didn't want to do that again. So I found myself a personal trainer, and he and I have been working together. He told me the other day it's been 3 years. And I walk. I try to walk 10,000 steps a day. Recently, I've not been able to do that for whatever reason, but last time I did.
And stop. Now I want you to do that one more time where we did it, so that you can see the difference between every one of them. Let the first one be here, come all the way down, come all the way up. Okay, hands up behind your head, all the way down, all the way up.
I will use my own mom as an example. She was an artist when we were young, growing up, and then working didn't allow her that time. And she retired 10 years ago and said, you know what, I'm gonna go back and do these things that I haven't done in a long time, and I'm going to try to do them differently. And that, I believe, really helped her to age well. And it kept her connected to the community.
My husband said to me, you need to go back to school. You find too many things for me to do. And so I thought to myself, oh, at my age, you don't go back to school. So I'll apply just to make him happy. And surprise, I was accepted. So that began a journey where I was so nervous, going into a classroom with all these young people who have just finished their undergraduate work, and here I am, this old lady who was so out of it, so, not so adult, that I thought, oh, I'm not going to be able to keep up. But I soon learned that that wasn't true.
So I think education plays a role in successful aging in several different ways. First of all, getting an education earlier in life is correlated with being driven, having a motivation to learn. So they're spending their lifetime or their careers constantly thinking and evolving, and that's going to set us up for better cognitive health as we age. But also continued interest in education is beneficial. And I think we see older adults doing this in a couple of different directions. One is looking to continue learning on their own, getting more education, continuing to learn. But another is through teaching and mentoring. And I feel like that is also another aspect that will keep us healthy longer.
About halfway through that master's, I realized that most learning going forward is going to be electronic. And so I just continued on, got another master's in academic technology. It's about 30% of my work now. I have an incredible boss here, the head of this department, and so she let me design this room because I wanted an active room with space in the middle. So I usually teach in this room.
I've offered to do another class just because I know that there's empty spots. What was I doing in 10th grade? I couldn't have cared less about world history or anything that had to do with that. And that's why these classes are in the auditorium are packed. And anybody that's newly retired, fresh out of their teaching or anything, we need them to volunteer to do classes.
One of their invitees consistently was a woman who came and showed how she had gotten started as a hobby in genealogy, which many people in their 60s and 70s get into that as a hobby. And that she'd published several books on family histories that she'd uncovered. I attended most of those lectures. I was fascinated by it. The moment I got the DNA results back about it, I had a general meeting about the value of doing your personal DNA, both from the health side as well as the genealogical side. And a number of people came up and said, I've got this situation where if we had a course, I'd be there.
And I found a glass blowing class and a ceramic class, and I was in heaven. That I needed to do three-dimensional work. So I didn't do glass blowing, but I did glass designing. I used a hot glass out of the kiln, 2,000 degrees, with a ladle. I was in my 70s. And then I found ceramics, and that was really what I need to do even today. I started a ceramic class with 2 students, and I ended up with 50. And it's still going. My student is a teacher now, and we keep getting more and more people involved.
We're going to see oh, you're bringing it up. See, a little at a time. It's amazing how it spreads, isn't it?
Yes.
If I had to give one piece of advice to those looking to age gracefully, successfully, healthily, happily, is to recognize this is your journey, and that we know a lot of great tips from research and from the lives of other folks, but this is your journey, and so you get to find your meaning, your purpose, the way that you're supposed to age. We can't worry about what everybody else is doing, and so live your best life.
I'm going to ask someone to take my cell phone and take a picture of us so I can send it to you. Yes.
So was it a success in the sense that other people made the bubbles and got a kick out of it?
People had some beautiful birds.
The birds are easy because you're
No, but the whole painting was
Okay.
nice. So yeah, and I
know if people would come back if we do have this class. We should have 2 sides of everything according to Ollie. And so I don't see that how history
I mean, this is, right now, I'm just learning about history. Rich, if you got something?
I thought the way he presented.
2, 3, 4. Last one, and hold it. Hold it right there. Now, come on, I don't care how old or young you need to be. And stop right there. That's perfect. High five.
So the key to success for you is to stay up to date, current with all the assignments, because it's very easy to get behind.
Oops. Yeah. How do I stop this? All right, I gotta figure out how to stop this. Okay.
In our chat box. So please, if you can take our survey and let us know what you thought about the event. And also we're gonna do our best in poll or best in showcase poll, and then we can continue talking with Chris about his film. So are you able to pop up the best in showcase poll before we have anyone jump off the call?
Yeah, so this is a really, so this is just a fun activity for you. Out of so many great presentations, if you have to pick one, which was your favorite?
And while we're polling, Chris, I just wanted to ask about, I kind of know this already, but just for the group, what are your plans with distribution for your documentary?
Yes. As you know, the people who were involved with the film, what I'm trying to do is balance, because I was a professor, so my inclination would be to just put this on YouTube and let anybody who wants to watch it. But on the other hand, some of the people who are in the world of films are saying, you know what, that actually can diminish the value of the film. So for anybody who's interested, particularly if they're in education, I'm more than happy to give them what's called a private link to the film so they can show it in a class or show it to friends or whoever it might be. And at the same time, what I'm thinking about is maybe doing film festivals, because that'll help increase the value of the film. And then also to then maybe hopefully have it be added to something like Kanopy, which is a streaming service that university and public libraries use. So in the short term, that's the plan. After I've seen it, we've shown it, of course, to all of you who were involved in the film. We showed it up at Ollie and also to the Emeriti up at Cal State Fullerton. We had about 150, 170 people there. And that was, it was really fun. And then having seen it today, there are a couple other things that I'd like to do to just enhance it a little bit. So that's kind of the general plan right now.
Great question. I was actually going to message you about using it in class, so that's wonderful.
Sure. You know what? Let me put my email address in here.
Any other comments or questions on this? We're at our end here. So questions or comments on any of the presentations or overall? I'll throw out a quick comment. I was really enjoying kind of a different look at gerontology through some of the more artistic elements. So maybe one of our future showcases needs to be like all art, I don't know, different artsy and creative ways to think about gerontology, because that was something I've just never really done before. So I enjoyed that.
And there are some powerful studies out there about the power of creativity and aging and longevity. So it's something we got to integrate more.
Yeah.
So
I was just going to say, it struck me that even just a phone call is sort of a form of creativity when you're engaging someone in a conversation, particularly if they haven't spoken to somebody for a while. Of course, the poetry. And then we also saw through the film, several of these people have been actively involved in creative endeavors. So maybe it's not so much that it's a particular one, but it's just getting people involved and engaged in something.
Yes.
Alex, can you drop your contact information for anyone interested in the program?
Yes, I can.
Fantastic. So has everybody voted that wants to vote for the Best in Showcase? It's kind of remained static, but we've got a head-to-head race here between the presentations. So I'll do a final 5. I'll do a countdown of 5. So be sure and vote if you haven't. 5, 4, 3, 2, 1. Drum roll, please. Congratulations, Sarah, with your Poetry is Oh, wait, somebody just came in with a vote. We have a tie. We just have a two-person tie. Boss, what do we do with that?
I don't know. We'll privately discuss the plan and we'll let you all know, but
well, your top vote getters is the Poetry is Power with Sarah and the Longevity Diaries with you, Chris. So clearly the overtly creative presentations have won, but it was very, very close with the other presentations as well. So typically we do a gift card to the Best in Showcase, but and we'll figure this out, and Sarah and Chris will be in touch with you, but congratulations. And I'm going to turn it over to my colleague Amiko to wrap things up for us.
Yeah, well, so thank you all for coming out here. I just posted the CCGG membership website link. So this is one way for us to stay in touch. And then we're going to be planning to roll out more fun events and then engaging social networking opportunities for all of us who are in the field. So if you would like to stay with us, just become a member. So the membership website is on the chat. And then I look forward to seeing you again in the next event.
And congratulations to the planning committee for today's event. We're so appreciative of the hard work that you put into this. So thank you, Amiko, Mary, and Donna. You guys are amazing.
Thank you.
Have a great day, everyone.
Thank you.
Bye, everyone.
Take care.
Donna, if you want to stop the recording.
That's what I'm looking for. I stopped it earlier. There we go.